All right, let's talk about some Parovirus here. So we got Parovirus seen in sudden anemia of a sickle cell patient. The sickle cell, we have a sudden drop in hemoglobin and a giant, huge Parovirus. That's a transient aplastic crisis that's caused by Parovirus B19, not folate or hydroxyurea. Now let's talk about this. It's a little bit confusing. So receptors that are used by viruses. So Parovirus B19 has this P antigen receptor on the red blood cell, and that can be used by viruses. And so you have a 12-year-old girl who has sickle cell, exertional dyspnea and fatigue and pallor, and she's got 5.6, so super low hemoglobin. In her bone marrow, she has decreased erythrocyte precursors, giant pronormoblasts with viral inclusions. And why is this? Well, we just said it. It's because the receptors used by viruses in Parovirus B19 are the P antigen on the red blood cell. So it's going to be infecting that, and you get the transient aplastic crisis. So we got a child with sickle cell, lethargic, severe anemia, bone marrow shows giant, huge dudes, inclusions. What's going on? Parovirus B19. So Parvo will halt the red blood cell production by attacking the bone marrow. And sickle cell patients rely on that high turnover, and so that temporary pause in red blood cell production leads to severe problems quickly. Folate deficiency is common because we see big things and we're like, oh my gosh, and so macrocytic anemia, you have the bone marrow, which causes the megablasts and hypersegmented neutrophils. But that wouldn't explain the viral inclusions or the sudden drop in the red blood cells. And so it's not the answer. Hydroxyurea, that can cause mild macrocytosis, but not aplasia. So the macrocytosis isn't enough. You have to think more deeply. Iron overload, sickle cell with chronic transfusions, bone marrow shows increased iron stores. Iron overload is not the answer because it doesn't cause acute anemia or inclusion bodies. And chemical exposures, benzene leads to pancytopenia and hypocellular marrow, but no viral inclusions would be seen. So it's really the virus using the receptors of the Parovirus B19 really cues you in that P antigen on the red blood cells. Okay, in recap here, we got the Parovirus here is a non-enveloped single-stranded DNA virus, and we're going to see the tropism is going to be these erythroid precursors, the P antigen that we talked about. Bone marrow, you see the decreased erythroid lineage, so the huge pronormoblasts are going to be seen. Symptoms, rapid drop in the hemoglobin, pallor, fatigue, sickle cell, hereditary spherocytosis. Those are the people that are at risk for these diseases because the antigen's on the red blood cell. And so the duration is going to be transient, 7 to 10 days. So hopefully this is helpful. If it was, go ahead and like and subscribe.